All of us come here to do good work every day.
We all got into healthcare to do the best we can for patients.
And you have to remember, when those patients come into UHN, they're at their most vulnerable state.
We put our trust in the people within this hospital, and so we expect to get in and out of here in one piece.
But we're human and we make errors.
And it may be because people are working too fast.
Sometimes the supports are not there.
And sometimes even the system that we have actually set up a possibility for humans to make error.
It could be a lighting issue that they didn't read a label properly. It could be fatigue. It could be a distraction. The best people make mistakes.
When an error happened, every one of us who is directly or indirectly involved, we don't feel good about it.
I can remember that event like it was yesterday.
It made me feel horrible.
I really almost killed someone.
I know exactly the pain, the shame, the embarrassment that I felt.
Well, I hate myself.
I thought I was frightened, scared for my life.
It was transformational for me in many ways and crystallized my own passion for safety.
We can no longer turn a blind eye to some of the safety issues that are happening within our hospitals.
And why now is because I don't think it's getting better.
And there's no question that errors can be prevented.
UHN has the opportunity to lead in this regard.
We don't want our patients nor our staff to be harmed by preventable errors.
Caring safely means being able to prevent harm.
It means embracing safety as a core value in our organization.
Where all our staff feel that they are all safety leaders.
Wanting to provide a safe environment for myself as well as my co-workers.
Without healthy working staff, we can't have healthy patients.
Because ultimately, if it's bad for the patient, it's really bad for our staff.
There's certain never events that really shouldn't occur in hospitals that we can actually prevent.
But there are going to be things that happen that maybe we haven't identified.
We have to state a goal of 0 safety events, getting to 0.
And we wouldn't be doing our patients justice if we were okay with some incidents happening.
We can see from the experience of other organizations that this type of goal is achievable.
And there are hospitals that have turned the tide and actually decreased their serious safety events.
The objective is, when a staff member A makes a mistake, how do we build in a redundancy? How do we build in a safety net so when that error happens, either your peer catches it or we have support system that alerts the staff that something wrong is going on?
Every time a human makes a mistake, we need to look at what was it they were doing, and was there a system issue involved that we can correct or mitigate happening again.
And fixing them for the long term.
We need to recognize that many errors inside medicine today occur as a result of communication gaps and as a result of cultural things such as fear of reporting.
Caring safely means that we have to change the culture that we were brought up in,
which is described by many people as shame and blame.
Then we need an environment where when that person notices something, they feel empowered to actually question that and to raise that as a concern. And then the response to that is, thank you very much.
It's about focusing on what we could do better, not who did what wrong.
Because when you speak up, what you're trying to do is prevent that person from making an error.
When it comes to safety, there's no room for ego. It's all about the patient.
Success is very much where people have a comfortable environment that issues can be brought to the fore.
The trick is not to do it again. The trick is to actually learn from it and not keep it to yourself, but share it with others so that somebody else doesn't make the same mistake.
We should reward people who report incidents.
If somebody raises a safety issue in one of the huddles, we recognize them often with a good catch letter.
We want to keep our co-workers safe. We want to keep everybody working in all the capacities in the hospital safe.
We want to ensure that our patients and our staff are safe every day.
We all have the power to make a difference.
Be part of the solutions.
And help us design a better environment for caring for patients.
We're committed to caring safely because it's the right thing to do.
It's time to act.
You're responsible for people's lives.
Caring safely is with us, and it will be with UHN forever.